As they're sucking my blood, they're releasing compounds into my body
Okay,
at
so
the
let's,
same time?
pretty much yes. The answer is yes. But in addition to quote unquote sucking the blood, what actually happens is after the leech bites, it accesses the space in between the cells, and what it does, it removes all of the byproduct of the cell metabolism. So you can call it like garbage or whatever you like to call it, and it removes it with the interstitial fluid, which becomes your lymphatics. And of course, blood is going to be mixed with that fluid because hirudin is the component of the leech saliva, the first and the most well known to us, the first to be discovered and the most known to us, acts as a blood thinner and a blood clot buster.
Now I take blood thinners. Is there going to be any complication?
No. So, despite the fact that you do take blood thinners, you can actually still do the leech therapy.
Okay.
But what we're going to do with you, we're not going to allow a lot of blood to be taken out. And we're going to pack the wound really, really nicely because you're going to bleed regardless whether you take it or you don't take the blood thinner, right?
How long does it bleed?
It's going to bleed for probably 12 hours at least. Now, with you, it might be a little bit longer because of the blood thinner.
Okay.
So yeah, in the first 20 minutes after it bites, it's going to inject the saliva, and that's the therapeutic compound. Yeah. So.
And this is the first session, correct?
Yeah, this is the first session. Yeah, we're going to treat peripheral neuropathy. We're going to do back pain, and we're going to do vertigo for this particular gentleman here.
And how many sessions would you recommend?
Well, we're going to do 3. Well, actually, after the first one, we're going to see how things go. And then what we're going to do, we're probably going to do a sacrum to hit the low back and exiting nerves from the lower back. Then we will consider what bothers the patient more, either the vertigo or the peripheral neuropathy. We know that the peripheral neuropathy is quite painful, so I may actually want to treat the legs.
And what do you recommend, like in between the sessions, like wait a week, 2 weeks?
Because it's a chronic problem, we can do once a week, we can do twice a month. If it was an acute problem, you can do this actually every day. If it's an acute injury, if there's a lot of trauma, surgical issue, can be done more than once a day actually. Can be done every day, but this is a chronic issue.
When I had the impingement, is that acute pain as well as chronic?
Well, your shoulder, yeah, it's a mixture. It was acute
So would
and
the
chronic.
leeches help for the impingement?
Yes, for the pain, yeah. Not for the actual rotator cuff injury,
Okay.
yeah. It's not going to repair your rotator cuff, but it will take care of some pain and some of the discomfort.
I never thought I'd get my shoulder back, and here
And
I got
here
full
you
use
go.
now.